The healthcare costs in the US are not sustainable at the pace that they're growing, and we need to work innovatively and creatively to try to figure out how to reduce those costs and be more efficient.
A lot of the things that create inequities in healthcare are not part of the complete healthcare system. It happens outside of healthcare. There is a very clear spotlight that has been shown on how diverse the experience in healthcare is across our country. And so what's really interesting for us is to say, how do we continue to close that gap, and what does that look like?
$1501 Health really came about around 3 years ago. We were still operating relatively in silos in the provider world, the payer world, and the startup world.
We are one of the only incubators that is a payer and provider partnership. If you have a product that works great in the payer space, but the providers aren't going to use it, and vice versa, it's not going to go anywhere. So we bring these two organizations together to really tailor that process and make sure that we can find a solution that satisfies both parties.
And this takes a partnership between institutions like payers and providers, as well as innovative and groundbreaking startups, to help us understand what's the right approach that we can use in the future that can scale at a population level.
WellSet is a platform to find and discover wellness practitioners through group classes. We set out to build WellSet because we saw an issue with access in prevention and holistic care. We have a huge epidemic of chronic illnesses in this country. Most of them are preventable, and most insurers and payers and provider networks don't know how to access people at home to change their lifestyle. We had launched a really incredible marketplace to find and book wellness practitioners and holistic providers, but we were having a really hard time with the out-of-pocket costs associated with consumers actually being able to book those sessions. So we were really excited to be accepted into an incubator that would help us sort all of this out.
So the 1501 experience is very personalized. From the application and the onboarding process, we were asking these companies, what exactly can we help you with? Because we want to make sure we can connect them with the right tools and the right resources to support them and help them grow.
It's really rewarding to see the light bulb moments occur with our startups in the cohort when they understand how they might be able to pivot to enter new markets or refine their technology or their approach based on the input that they're getting from our mentors.
Care Team is a tech-enabled care team and clinical services team to help vulnerable patient populations access care at their local health centers. So one of the roadblocks that we were facing as a startup going into the application process of 1501 was that we were pivoting our market while keeping the same product backbone. As an early stage company, you really don't have a lot of resources, and so being able to have a network of people to help us learn very rapidly, prioritize that roadmap, and make the right investments was really important. So some of the really great opportunities for collaboration within 1501 has come from the members of the cohort and the other companies. I'm talking to Baby Live Advice about how can we go into FQHCs and offer our services as Pair Team, not just for value-based care and preventive services, but also we can help extend access to maternity services through Baby Live Advice.
Baby Live Advice is a telehealth-enabled service that supports mothers and their babies from preconception to early childhood. The mission for Baby Live Advice is to change the care models in maternity to a hybrid model that supports both the physician and the parents at the same time. So definitely being a woman health startup is very difficult. There is not a lot of understanding of the day-to-day and the struggles that it requires from you. So I think that that's been a real challenge personally for me. So my experience with 1501 has been amazing. It's just great support, right? To have somebody there who's like you, who's going through the same struggles as you are. We also support each other quite a bit, and I love that.
The entrepreneurship journey is such a lonely journey often. In order to innovate, you need to bring different perspectives to the table. And so the really interesting thing that we see in our 1501 Health cohort is this widening of the aperture around what healthcare really looks like. That's really exciting, and thinking about what are the community level pieces in healthcare that influence the way that we experience both our daily habits and how we intersect with the healthcare systems.
It's going to require us to utilize deep technology in some instances, but in others, it's going to require us to really exercise deep empathy so that we can truly connect with our patient communities in new and sustainable ways. It's not just technology for technology's sake, but empowering the human element in healthcare.
Even Health is a mental well-being company focused on providing digital solutions for high-stigma populations, such as the Air Force and healthcare workers. Even Health's mission is to make mental health destigmatized and accessible for everyone, so people are comfortable talking about their feelings or what they're going through in a safe space. Technology has enhanced certain things of matching and trying to provide resources of what you may need. Mental health still requires a human component to it, so there's technologies just there to enable it and help more people get access to it.
One of the examples of how LifeBridge Health and 1501 Health has been able to move forward this mission of reducing the digital divide is our partnership with LiveChair.
LifeChair Health accesses, influences, and engages hard-to-reach ethnic minority populations in barbershops, salons, and churches, and other community venues to improve healthcare outcomes and reduce health disparities. The value that 1501 Health has brought is unprecedented. Being able to get tangible material answers and feedback from your customers, payers or providers, is something that most startups dream about. So we were lucky and fortunate to be selected, and we've enjoyed our experience.
It's been very rewarding to see the growth of LiveChair as their mobile app is now being used by thousands of barbershops across the nation, and they've actually grown to over 30 states at this point in time.
What we want to do with 1501 Health is raise the overall health ecosystem. And so what I'm really looking forward to is every single cohort being told by the startups that we work with what is helping them, and to leverage the resources that we have to their benefit to be the best partners and supporters and cheerleaders for them possible.
We're really going to rely on them to kind of build that community, to offer new cohorts guidance and kind of tips on how to really take advantage of everything we're offering 1501, how to use our experts, what questions to ask for, and really what to focus on.
Through our successes with our first cohort and next year's cohort and future cohorts, we're going to be laying a blueprint for how payers and providers can collaborate around data sharing, building more trust, improving efficiencies, and reducing bureaucracy. We want to collaborate directly with these startups to shape the solutions and disrupt the status quo and ask why not.